Hi, I'm Dr. Shaw, and I'm going to talk with you guys about frequently asked questions about newborn babies. First off, let's start out with feeding stuff. So within the first week of life, most babies start feeding roughly between 2 to 3 ounces every 2 to 3 hours. For those of you who are breastfeeding, that usually translates to about every 2 hours, maybe a little bit longer if things are going really well. With formula-fed babies, it very quickly jumps up to 2 to 3 ounces every 2 to 3 hours within that first week. We usually tack on about an extra ounce per feed for every every month older that the baby gets. So usually by the time I see you guys at 2 months, they're up to about 4 to 5 ounces per feed there. Poop-wise, babies in the first 2 months of life are the most irregular poopers on the planet, particularly breastfed babies. They can poop anywhere from 5 to 6 times a day to no poops for 2 to 3 days, and a lot of sharts in between, for lack of a better word there. You may see all sorts of different colors with baby poop. There's only 3 colors that we really worry about: white, red, and black. Those would be the things we'd really want to know about there. Other than that, you will see every color in between there, and you will see green and yellow and brown and orange, and those are all normal. There's entire websites dedicated to baby poop green, and that is totally okay. There's nothing wrong with green baby poop there. Let's talk about sleep. Two biggest things for sleep here is that the baby is in their own bed and on their back. Those are the 2 best things that you guys can do to help to reduce the risk of SIDS. In the first couple of weeks, sometimes babies can have a little bit of trouble with their day-night cycle. If you concentrate on keeping their feed schedule tight during the day, oftentimes things will work out better for you guys at night there. Let's move into baby rashes. Frequently, babies get all sorts of funny looking rashes, and most of them are completely normal and benign, but let me go over a couple of them with you. The first one you may see in the first couple of days is called erythema toxicam, or ETOX. It usually tends to be kind of a pink splotchy rash. It can be anywhere on the body and tends to have like a little white dot in the center of it. It's completely benign and it goes away within the first 3 or 4 days there. The next thing you may see is something called milia, and those are little white dots across their nose there. They're little clogged pores, and they will resolve on their own without you doing anything about them at all. The next thing you may see is baby acne. When babies come out, they basically go through puberty in reverse, and they have to flush out all of mom's end of pregnancy hormones there. And so frequently they'll break out in acne all over the place. And you'll see little bumps and pustules all over their face and around their chest and back. There's nothing we can do about it, and there's nothing we really need to do about it. Sometimes it can get kind of dry and crusty, but ultimately it resolves on its own. The next thing you may see is something called cradle cap, and that can oftentimes be in the eyebrows and on the scalp there, and it can be this kind of yellow crusty stuff. It is benign. There are sometimes we want to treat it there if it gets really thick and nasty, but as a generality, we don't do a heck of a lot about it there. The other thing to note about babies is when they first come out, they look like they have really dry skin kind of all over their body there. This is not dry skin like you and I think of dry skin. They basically lived in a hot tub for the last 9 months there. When they come out, they want to slough off all that first layer. So once you do a real bath, it's all going to come off, but you don't need to put lotion on them right off the bat. Last thing to talk about is just a couple of weird things that babies do that tend to freak people out, but are actually all normal. They sneeze a lot, they hiccup a lot, they twitch a lot, they snort a lot, and they breathe kind of funny. Those are all very normal baby things and absolutely nothing to worry about. Thank you guys for tuning in. We really appreciate it.